Hi, and welcome to Chapter 6 of your pre-hospital emergency care textbook. We're going to be talking about lifting and moving patients. This is something that's done on every single call, and we need to make sure that we do it so we can have a long and healthy career. Take your time to go ahead and review the overview of lesson topics on this slide, as well as the case study and the introduction on the next few slides. All right, starting us off on something you really need to know is body mechanics. The definition of body mechanics are the efficient methods of using the body to gain a mechanical advantage. This is important because if you perform these tasks improperly, bodily injury, strain, and lifelong pain can result. So make sure that you utilize good body mechanics whenever you lift and move patients. All right, we have four principles of body mechanics and safe lifting. Number one is keep the weight of the object as close to the body as possible. Back injury is much more likely to occur if you're reaching out at a great distance to lift a light object than while reaching a short distance and even lifting a heavy object. Number two, to move a heavy object, use your leg, hip, and gluteal muscles plus your abdominal muscles. The use of these muscles will help you generate huge amounts of power, but doing it safely. Always avoid using your back muscles to avoid moving a heavy object. Remember, you guys, never lift with your back. Our other two principles, 3 and 4, are number 1 or 3, stack. Visualize your shoulders stacked on top of your hips and your hips stacked on top of your feet. Stand upright when you're lifting. Do not bend over or twist. These are both forces that are potentially harmful to your lower back. And then number 4, if possible, reduce the height of the lift and distance through which you're moving an object. Get closer to the object or reposition it before lifting, as you can see this EMT doing in the picture behind the script. It's important that you guys maintain health, fitness, as well as proper posture to make sure that you have a long and healthy career. Two problems that can happen with your spine are lordosis and kyphosis. Lordosis is an extra inward curvature of your lumbar spine, and kyphosis is an extra outward curvature of your thoracic spine. You can see both of these on the next slide. Also, view the following slides to make sure that you remember good posture. The most important aspect of lifting and moving patients is good communication and good teamwork. It's important, you guys, that you're all properly trained and physically matched when lifting a patient. The most important aspect of lifting is communication. Communicate with your patient, communicate with your partner, plan your lift before you do it, and then communicate throughout your lift. A couple good pearls for lifting and moving patients is number one, know your abilities or know your limitations. Don't try to lift a patient who's too heavy for you to lift. Consider the weight of the patient and the equipment being used. Make sure you're trained on it before you get there. And if you need additional assistance, call for additional assistance for that patient. Always use an even number of rescuers, as an odd number of rescuers can cause things to be unstable and more likely to drop a patient. And lastly, anticipate muscle fatigue. As you get tired, you're more likely to lift with bad body mechanics. Your book has two different types of lifts that they recommend that you do. Number one is the power lift, and this is a technique that offers you the best defense against injury and the best stability. The power lift you guys can see in the next couple slides. It's the basic squat lift where you stand with your legs shoulder width apart, you stack your shoulders, hips, and feet, and you bend and use your leg muscles to help lift up the patient. You do this with an even stance. They also recommend that you use a power grip. A power grip, per your book, is making sure your whole hand and fingers are in contact with the object at all times. The other type of lift that your book utilizes is called the squat lift. The squat lift is for an EMT who maybe has an injured or weak leg or ankle. This is best performed by putting that weak leg or ankle forward and using that back leg as your main base of strength and support. This helps in instances of an injury or other weakness that you might have to account for. You can see the squat lift being performed on the next slide. If you ever have to reach out for an object, try to keep your back and your abdominal muscles tight, prepared for the lift. As possible, get as close to the object as possible. And limit reaching from 15 to 20 inches in front of your body. You should never lift further than 15 to 20 inches in front of your body, as this can likely injure your back. When lifting and moving patients, remember that we should always make sure that we are safe first, and then we also want to make sure that our partners and patient are safe as well. When lifting and moving patients, we have three different types of moves. We have emergent moves, urgent moves, and non-urgent moves. We'll talk about each in the following slides. An emergency move should be used when there is an immediate danger to both the patient or the rescuer. In this situation, we want to move the patient and make sure that both of you guys are safe. Below and on the next slide are examples of emergency moves. An urgent move is performed when there is a life threat or an immediate threat to the patient. We want to move the patient as quickly and safely as possible. In this situation, there's no threat to the EMT, so we can take a little bit more time to make sure that we are safe and we're moving the patient as safely as possible. In these situations, maybe our patient will be self extricated from a vehicle, or they will be rapidly extricated by the EMS crew or the fire department crew. Lastly, a non urgent move is when there is no immediate threat to the provider, to the EMT, or to the patient. We can take our time and transport this patient as safely and as effectively as possible. Take your time to communicate and plan your moves when dealing with a non urgent move. Below are a couple different examples of non urgent moves that can be used in the field. The next few slides are going to show specialized equipment that are geared to help us move and lift our patients safely. We'll have different types of equipment and we'll talk about each as they come. On this slide, as well as with a few of the following slides, we have an example of the wheeled stretcher. Most wheeled stretchers can accommodate anywhere from 500 to 700 pounds of a patient. All right, we should always maintain at least 2 EMTs when using a wheeled stretcher. Some of them are motorized and mechanical, while some of them are mainly manual. You will be familiar with the stretchers that you use in class, and then familiarize yourself with the equipment when you go on your ride outs and when you begin work. A bariatric stretcher is a stretcher used for obese patients or morbidly obese. Bariatric devices typically are geared for patients who are morbidly obese and grossly overweight. In this situation, we need to call for specialty equipment. A bariatric stretcher normally comes with a bariatric ambulance. It is wider and is geared to hold anywhere up to 1,600 pounds. On the next few slides, we have some examples of portable stretchers. These are lightweight devices that can be used to lift and move patients without having to use and lift a heavy wheeled stretcher. The next couple slides show EMTs using what's called a stair chair. A stair chair is not a wheeled stretcher. However, it's more like a wheelchair that's allowed to maneuver around very tight spaces. It also has these tank tread tracks on the back that can extend out and help our patient descend down stairwells and stairs at a slow rate. This helps us not to have to lift patients up and down stairs. On the next couple slides, we have backboards. Some of you guys are probably familiar with backboards as they're used to help keep our patients' spines immobilized, intact, and straight. We have long backboards as well as short backboards, and we'll be familiarizing you further on these different types of equipment in class. The next slide shows an equipment called a scoop stretcher. A scoop stretcher is kind of like a shovel that can be put on either side of the patient and scoop the patient up. It will disconnect on either end and can be connected again underneath the patient. It's not recommended for patients with spinal injuries, but very useful when dealing with patients with fractures and patients in lots of pain prior to movement. Lastly, we have a Stokes basket or a basket stretcher. These are stretchers that are going to be geared for all terrain, mostly used in search and rescue situations, but not typically used on the ambulance. The next device is called a flexible stretcher. It's also called a reef stretcher or a mega mover. These are very useful in restricted spaces or tight corridors, and we can simply slide one underneath the patient and lift them and move them. It's similar to a tarp with handles on either end. A neonatal isolette is used for newborns who are very sick or ill, sometimes for premature babies. These isolettes protect patients, they keep them warm and protect them from bacteria. These are typically only seen in CCT or critical care transport cars, typically dealing with a CCT paramedic or a CCT nurse. For first steps of treatment, the most simple treatment we can do for a patient is simply just by positioning them. Most patients will ride either in a sitting position or a position of comfort. However, for some patients, maybe patients in shock, it's best to put them on a supine position or flat on their back. Patients with difficulty breathing or respiratory distress prefer to be in a sitting position as it eases their breathing. Any patient who has maybe a not intact airway or maybe is vomiting should be positioned on their left side in what's called left lateral recumbent position or recovery position. These will help keep a patient maintaining their airway if they're unconscious and not able to do so on their own. It's also great for a pregnant patient following their 20th week of gestation or pregnancy. They should be positioned on their left side because sometimes the weight of the baby or fetus can push down on some of their major blood vessels and cause them to be weak and dizzy.